Good morning, everyone. Kindly stand for the playing of the national anthem of St. Christopher and Nevis.
O land of beauty, our country where peace abounds, thy children stand free on the strength of will and love, with good in all schools, Saint Kitts and Nevis. A nation bound together with a common destiny. As stalwarts we stand for justice and liberty, with wisdom and truth. We will serve and honor thee. No sword nor spear can conquer, for God will sure defend. His blessing shall forever to posterity extend.
Please remain standing for the invocation, which will be delivered by the President of Essence of Hope Breast Cancer Foundation, Ms. Cam Hendricks.
Thank you for this day. We thank you for this day. We ask your blessing on all who are gathered here to share their wealth of knowledge and those who have come to listen. We hope by the end of this discussion, we would have taken something away that would make a difference to us and our families. We pray for all those who are suffering with this dreaded disease called cancer. Father, we ask for your healing touch from, from you in their bodies and minds. We ask you to comfort them and let them know you are still God and you never fail. Bless those, bless those who are thrivers of cancer. We say thank you for your deliverance. Bless each and every one of their families who are suffering with them. Father God, we thank you for everything. Continue to bless us in Jesus' name. We also want to say thank you for this organization called Essence of Hope. Bless our members as we try to continue to educate the nation about breast cancer and all other cancers. Father, we ask for a special blessing on us because we really do work hard. Father, we ask you to grant us grace, your mercy, in your precious name. Amen.
Thank you. You may be seated. On behalf of the Essence of Hope Breast Cancer Foundation, I want to thank each and every one for taking a little bit of your Saturday time to join us. I'm sure you could have been doing something else, but your presence here really means a lot to us. Today we are hosting this health forum that we have dubbed Redefining Cancer Coverage. My name is Marcus Nato. I am the PRO of Essence of Hope Breast Cancer Foundation. At this time, we are going to invite the Spirit drummers to come forward and help us to open and kick off the forum in an exciting and energetic way. Welcome them as they come. thank you very much to the Spirit drummers. Give them a round of applause once again. At this time, I will invite our secretary for Essence of Hope, Ms. Marva Pinney, to bring welcome remarks. Please welcome Marva.
Good morning. Miss Mary Armstrong, President of Essence of Hope Breast Cancer Foundation, Dr. Marcus Nutter, VP and Public Relations Officer of Essence of Hope Breast Cancer Foundation, Dr. Hazel Laws, Chief Medical Officer, representatives of insurance companies, ladies and gentlemen, esteemed guests, cherished survivors and thrivers. Welcome to our health forum, Redefining Cancer Coverage. It's an honor to stand before you today representing the Essence of Hope Breast Cancer Foundation. As the secretary of this esteemed organization, I am deeply moved to witness such a diverse and committed gathering, all convened with the shared goal of improving insurance coverage for cancer, with a special emphasis on breast cancer. Before we delve into the rich discussions and collaborations that lie ahead, allow me to shed light on the essence of our foundation's mission and work. Established in 2009, the Essence of Hope Breast Cancer Foundation was born from a simple yet powerful vision to provide unwavering support, resources, and hope to those affected by breast cancer. Over the years, our foundation has become a beacon of strength and resilience in the fight against breast cancer, touching the lives of countless individuals and families. From funding life-saving research to providing financial aid for treatment, we offer a holistic approach to breast cancer support, encompassing everything from emotional guidance to practical assistance and advocacy. As we gather here today, surrounded by esteemed stakeholders and dedicated advocates, I am reminded of the profound impact that collaboration can have in shaping a brighter future. Together, we have the opportunity to redefine cancer coverage and ensure that every individual battling this disease receives the care, support, and dignity they deserve. The objectives of this forum echo our foundation's core principles as we aim to 1. Raise awareness. Together, we will shine a spotlight on the critical need for enhanced insurance coverage for cancer, particularly breast cancer, ensuring that no one faces this journey alone. 2. Facilitate dialogue. We will foster open, honest conversations among health insurance companies, healthcare providers, medical professionals, and most importantly, the courageous survivors whose stories inspire us all. 3. Propose policy changes. Our goal is not merely to discuss problems, but to propose practical solutions. Through informed discourse, we will advocate for policy changes that prioritize the needs of cancer patients. 4. Educate about early detection. Knowledge is power, and nowhere is this more evident than in the realm of cancer prevention. We will share invaluable insights into early detection methods like mammograms, empowering individuals to take control of their health. 5. Inspire advocacy. Today, we ignite the flames of advocacy and activism, galvanizing a movement dedicated to championing the rights of cancer patients and ensuring access to life-saving care for all. And 6, provide a platform for exchange. Lastly, this forum serves as a nexus for knowledge exchange and networking, where ideas are shared, connections are forged, and collaborations are born. Before I conclude, I extend my heartfelt gratitude to each and every one of you for your commitment to this vital cause. Your presence here today is a testament to the power of collective action and the enduring spirit of hope. In the spirit of partnership and progress, let us embark on this journey together, inspired by the courage and resilience of those affected by breast cancer. Together, let us redefine the narrative of cancer coverage and pave the way for a future where every individual can live free from the shadow of this devastating disease. We crave your indulgence and collaboration as we continue to save lives. Please feel welcome, and thanks for being here. Thank you.
Thank you very much, Ms. Pinney, Secretary of Essence of Hope. At this time, I will invite another one of our members to come and introduce our keynote speaker for this forum, Dr. Hazel Laws, Chief Medical Officer. So at this time, I would invite Kimmy to come and introduce our keynote speaker.
What keeps me going is being able to see the positive outcomes in respect to what is patients staying in St. Kitts and Nevis, receiving their care, and literally having the same survival rates for countries that are far more advanced. Dr. Marissa Grant-Tate, consultant medical oncologist in St. Kitts and Nevis principally, with postgraduate study in radiation oncology, clinical research, and scientific communication. If there is no other instance where someone becomes aware of just exactly how resilient they truly are, then it tends to come with what is a cancer diagnosis. I believe that many people, thankfully not all, but many people, when they are facing the possibility of a cancer diagnosis, then they tend to shy away, try to delay it, and so then ultimately this tends to create more long-term concerns in terms of what would be the stage of the disease and so forth. However, unequivocally, I can say that when a patient is brought to what is the center of truly understanding what their diagnosis is, understanding what their options are, and being able to understand that this does not equate to what is a death sentence, then this is where you see the fighting spirit coming through. And as I said before, there have been so many instances of just what has been wonderful resilience. It's, to be quite honest, it's a daily attribute that I see in many, if not all, of my patients. It's very important, and someone very dear to me once reminded me of a phrase, a quote by a famous American poet, and it always rings true to me, which is essentially to remind me that you cannot pour from an empty cup. And so then what that forces me to do is to essentially find my center on a daily balance, on a daily basis rather. I try to provide what is the necessary and accurate information, yet at the same time I also am such a lover of what is people in general that empathy comes to me quite naturally. I have quite a few people who know me from before I would have specialized in medicine or oncology more specifically, and they would have told me so many times over that this literally had to be for me, simply because of what is my ability to be able to empathize with others and essentially to be able to humanize people. And I think that is what is most important and what allows me to be able to find that balance in terms of providing what is the necessary medical care, yet at the same time being able to humanize them, which allows me to then be able to give the necessary support. And of course, finding what is my daily balance, my daily center, which usually comes in the form of what is some quiet time. Repair, it is absolutely necessary. So not only for patients, but also for myself. So many, to be quite honest, but most frankly I would put it under the broad umbrella of what we refer to as immunotherapy or targeted therapy. And this allows us to be able to take advantage of what are the specific intricate details that allow the differences between one person's diagnosis with breast cancer and another. And so then this is also very important because very often, not so much now, thankfully, with what has been much education in terms of, to the general public and so forth, but once ago, it was not at all uncommon to hear that, well, doc, I'm going to choose this option as opposed to the option that you are suggesting for me because I've known this person who had breast cancer and they opted not to do this treatment and they are still here 20, 30 years later. So I usually point out, well, apart from what are the specific differences that are, existent within patient to patient with breast cancer, cancer in general, but even with the same breast cancer diagnosis, you'd be just amazed to know how many differences you can have between a patient and another in terms of the specific biological makeup of that cancer. And so then what happens is that the advent of immunotherapy or targeted therapy, it allows us to be able to specifically treat specific genes, block specific substances, and essentially be able to provide what is a much more wonderful result compared to if this person had in fact not done this form of treatment.
Good morning to everyone. Dr. Hazelord is a graduate of the University of the West Indies, Mona campus. She has over 20 years of experience working in the field of primary health care and public health in various capacities. This includes her servicing as Chief Medical Officer for the Federation of St. Kitts and Nevis since September 2016. With formal training in public health, she successfully led the Federation in achieving validations for having eliminated mother-to-child transmission of HIV and syphilis by the World Health Organization, who in 2017 and the country has since maintained this validation status. More recently, she provided stewardship to the national COVID-19 pandemic response. Dr. Laws was also the recipient of the Companionship of Star of Merit Award for the National Service in a Crisis in May 2021. She is a proud mother of Gabriel, who is a young adult.
Good morning, everyone. Please allow me to adopt the protocol that was already established. I am humbled by the invitation to present at this very important health forum. I will aim to summarize the local data on cancer with primary focus on breast cancer. I will aim to estimate the cost of breast cancer care for our women in the Federation. I will also make recommendations as to how we can tackle this public health problem. What is breast cancer? I will not bore you with a definition. However, I will provide snapshots of lives with breast cancer. Rashida is 52 years with 3 kids. She was diagnosed with breast cancer 9 years ago. Her treatment included mastectomy and systemic therapy. She was maintained on tamoxifen. Rashida tells me, and I quote, "My diagnosis of breast cancer was not a death sentence. Rather, it was a diagnosis of mental illness for me," end of quote. She explained that she needed mental fortitude to cope with her diagnosis and the side effects of the medications. While on tamoxifen, she had to cope with depression and even suicidal thoughts. Rashida is now in remission and thriving. Suzanne is age 50. She was diagnosed 11 years ago. Her treatment included mastectomy and chemotherapy. In September of last year, she celebrated 10 years survival post-initial diagnosis, and all her test results were normal then. Fast forward to now, March 24. She is currently diagnosed with metastatic disease, with spread to her lungs and liver. Suzanne has been able to access the latest medications for her metastatic disease. She makes sure to keep her weekly luncheon appointments with her close friend and colleague who is a psychiatrist. She says to me that this is crucial for her survival. Suzanne is thriving. Cancer happens through a complex interaction of your genetic makeup and the world around us. Cancer arises from mutations or random genetic changes occurring in healthy cells acquired over time. Such mutations are triggered by genetic predispositions, lifestyle choices, use of medication like hormonal therapy for other medical conditions, and even exposure to radiation, pesticides, and hazardous domestic products through interactions with our environment, meaning the air we breathe, the water we drink, the soil we toil, and the food we eat. As these changes accumulate, mutated cells transform into cancerous growths. Please note, every cancer is as unique as the individual it affects. 2 persons may be diagnosed with the same type of cancer, but have only a fraction of shared mutations. Therefore, the lived experiences can be very different. So, what's happening in the world with respect to breast cancer, or cancer in general? Now, breast cancer is not just unique to St. Kitts and Nevis. It's an international or global problem. Breast cancer is ranked second in the world in terms of the leading cause of cancer. It's second to lung cancer and it is followed by colorectal cancer and prostate cancer. In the region, in the Caribbean region, breast cancer is also a problem. It is the second leading cause of cancer in the Caribbean. Second, and it's second to prostate cancer. What's happening in St. Kitts and Nevis? Now, between 2017 and 2021, in terms of all-cause mortality or overall deaths, we've had almost 2,000 deaths in this period, and 20% of these deaths was attributed to breast cancer. What's the most common cancer in the Federation? Breast cancer. Now, between 2017 and 23, we've had 533 persons diagnosed with cancer, and of these, breast cancer is the leading cause of cancer, followed by prostate, colon, skin, endometrium, and cervical cancer. This shows it in a different manner. Now, in terms of the cancers that occurred between 2017 and 23, 1 in 4 of these cancer patients had breast cancer. And this shows the overall breast cancer incidence for the Federation, 307.24 per 100,000 population. Now let's look at this slide carefully. Now, in terms of the patients diagnosed with breast cancer in our Federation, between 2017 and 23, most were within the age group of 50 to 59 years, followed by 60 to 69 years, and then 40 to 49 years. So in other words, the critical age range is 40 to 69 years. And so this tells us that we really need to encourage our women to start breast cancer screening once you hit 40. Between 2017 and 21, we had 43 deaths from breast cancer in the Federation. Now, in terms of surgical interventions, the surgeons performed 98 mastectomies within this time period, 2017 to 23. Now, data from the oncology unit at the JNF General Hospital tells us that between 2019 and 23, we had 109 persons diagnosed with breast cancer accessing care at that unit. Based on this data, it is evident that breast cancer is a public health problem in the Federation. Breast cancer impacts our women along with their families. Breast cancer is one of the most expensive types of cancer to treat, and the price continues to rise. In preparation for this presentation, I did a telephone survey of the vendors that provide care to breast cancer patients. And I tried to cost care of this disease. Now, once you're screened for breast cancer and it's positive, you have to undergo a number of tests in order to determine the stage of your cancer. Staging is important because it determines your prognosis and it guides the doctor in terms of treatment decisions. The staging is a bit complicated. The doctors look at the tumor size, its location, they look at the lymph node involvement, and if perchance the disease had spread. And so the staging can go from stage 0, non-invasive breast cancer, through stages 1, 2, and 3, invasive breast cancer, or stage 4. So I've attempted to cost or provide or estimate the cost for physicians or the health system to provide care to a patient with invasive breast cancer. In doing this, I took into consideration the need for psychotherapy, psychosocial support, the lab tests that the patient will have to do, and the pathology evaluation for the initial biopsy specimen and the post-surgical specimen. I looked at the various imaging tests that are required and even the genetic testing that's required. I also had to look at the surgical costs because most patients, a number of patients require surgical intervention. And so there's a range because it depends on the stage of your disease, determines the type of surgical intervention that you will be prescribed. And then I had to look at the systemic therapy, chemotherapy agents that would be prescribed. And then I did a telephone survey in terms of vendors in the region who offer radiation therapy. Now, this costing is based on private sector costing because the costing in the private sector approximates or almost equates to what the real cost is. I didn't use public sector figures. So I reached out to the private entity in Guyana that offers radiation therapy, Trinidad, Tobago, Bahamas, Jamaica. And radiation therapy can range from anywhere between $10,000 US to $26,000 US. And so the estimated cost to treat invasive breast cancer in the Federation, taking into account that you'll have to travel overseas for radiation therapy, ranges between 190,000 XCD dollars to 375,000 XCD dollars. So this is just an estimate. So as you can see, breast cancer is a very expensive diagnosis. But we can combat this public health problem through prevention, scaling up screening, earlier detection, strengthening our treatment services, and improving access to care. The adage, prevention is better than cure, is very applicable as we discuss this topic. Cancer prevention and control depends on human behavior. The Ministry of Health needs to scale up its cancer prevention programs to educate the public and effect behavior change. Let's think about it. If breast cancer is so expensive, it's wise to invest in prevention. Prevention is the best approach in tackling this problem. So the Ministry of Health needs to do a better job in encouraging our citizens to, one, engage in physical activity and try to achieve the recommended minimum 150 minutes per week of aerobic exercise. Physical activity reduces the risk of breast, prostate, endometrial, kidney, and stomach cancers. We need to do a better job. We need to find innovative ways of convincing our citizens that climbing or walking up Brimstone Hill reduces your risk of breast cancer and is therefore an investment in your long-term health. We need to convince our citizens to avoid red meat, avoid processed foods, avoid alcohol and sugary foods. The science tells us that these foods increase cancer risk. On the contrary, certain foods are protective. When I looked at the latest science and literature regarding protective foods, these include cruciferous foods. The science says that we need to consume 4 to 5 servings of cruciferous foods daily. What am I referring to? Broccoli, Brussels sprouts, cauliflower, cabbage. They prevent cancer. Consume more tomatoes. It's protective against breast, lung, and colon cancers. Consume more walnuts. They protect against colon cancer. Consume more berries. I mean strawberries, blueberries, cranberries, pomegranates, raspberries. They decrease cancer risk. Consume more garlic. This also reduces your risk of colorectal cancer. And so this is based on the latest science. Researchers Lyndon Glasgow et al. In a Lancet article postulated that we need to forge regional partnerships to conduct research to inform targeted, risk-based cancer prevention and education programs. We also need to explore virtual cancer education programs to provide unlimited access to preventative education and thus encourage behavior change. We need to reach our people through their phones. Scientific studies have shown that frequent use of chemical straighteners that contain or emit formaldehyde increases one risk of developing uterine cancer. Other studies have linked straighteners, hair straighteners, and dyes to breast and ovarian cancer. It is no surprise that as of next month, April 2024, the United States Food and Drug Administration will ban the use of formaldehyde in all hair products in the USA. That's important to note. I must use this forum to promote the HPV vaccine. It is a cervical cancer prevention vaccine. The HPV vaccine is recommended for preteens, 9 to 11 years, and it prevents cervical cancer. In essence, we must continue to prioritize cancer prevention in our health promotion programs. We must use scientific approaches and best practices to affect behavior change in our people. Cancer screening. This is another way in which we can fight this public health problem. We need to increase the uptake of breast cancer screening in our women 40 years and older. We need to increase the uptake of cervical cancer screening in our women in the reproductive age group. How can we achieve this? The literature suggests that if we incorporate culturally appropriate risk assessment into primary health care, this can change the interplay between individuals, their personal beliefs, and the desired behaviors we want. The researchers postulate that risk assessment can positively influence and increase screening uptake. So in other words, if you convince individuals about their risk of a particular cancer, chances are you'll get their attention in terms of screening and adopting the relevant lifestyle behaviors. The Ministry of Health is in the process of procuring a mammography machine to increase access to breast cancer screening in the public sector. The Ministry of Health also intends to collaborate with the Pan American Health Organization to introduce HPV testing and self-testing to screen for cervical cancer. In essence, we must be aggressive in scaling up cancer screening. Insufficient and late screening are major challenges that are contributing to the cancer morbidity and mortality rates in our federation. We need to awaken our patients' consciousness regarding their risk for these cancers. Let's look at treatment, cancer treatment. I want us to always remember that cancer is a time-sensitive disease, and all patients with a positive screening test must be quickly linked to treatment and care. There is a role for a nurse, cancer case manager, or cancer navigator or facilitator with the responsibility of helping the cancer patient navigate the cancer care continuum. Such an individual will help decrease the time between diagnosis and treatment. At the JNF General Hospital, we hope to formalize a multidisciplinary team approach to the management of breast cancer and other cancers. Such a team will comprise all the key clinical providers, along with a nurse playing the role of case manager. Such an approach will be advantageous for our patients. Studies show that countries with established cancer registries have greater success with cancer management programs. Therefore, we need to develop a national cancer registry. Initially, we can commence with a breast cancer registry. This will provide us timely data to inform appropriate breast cancer prevention and control interventions. We need to brainstorm novel ways to help our women access adequate breast cancer treatment and care. I would like to use this forum to ask the women who are present to take the time, use a microscope, and back-check your current health insurance coverage to ensure that it is adequate. Keep at the back of your mind the cost that I just shared. I advise you to read the fine print. In preparation for this presentation, I tried to do a survey of the products, the insurance products that are available to our women who are susceptible to breast cancer. I reached out to all the insurance companies, but I got formal responses from 2. And so this slide highlights the packages and the products that are currently available to our women who are susceptible to breast cancer. I implore the insurance companies that are represented here to ensure that you provide adequate coverage to our women and your clients overall. I must underscore that cancer is a time-sensitive disease, I said it already, and that insurance companies ought to respond and act quickly to claims and requests regarding cancer treatment and care. Currently, patients with metastatic disease can access care through clinical trials. I recommend that foundations such as this forge partnerships with regional and international organizations that can help our patients access essential care through clinical trials. I began by mentioning persons living with breast cancer. We are grateful that chemotherapy is available and accessible locally. The Ministry of Health endeavors to strengthen our oncology unit by exploring options for more affordable systemic drugs. The government needs to seriously consider the addition of radiation therapy as a treatment modality, such that our patients do not have to travel overseas to get this. Rashida highlights the need for psychosocial support for all patients diagnosed with breast cancer or any other cancer. This helps to improve health outcomes. The Ministry of Health just filled a clinical psychologist post at JNF General. Suzanne's case provides hope for the future. It informs you of the availability of new drugs for the treatment of metastatic disease and the need for us to forge partnerships with researchers involved in clinical trials. Together, we can beat this expensive disease through targeted prevention programs, risk assessment, more screening, earlier detection, and improving access to care. As women, we must ensure that we have adequate insurance coverage, and we need to do that now, even before a diagnosis of cancer. Breast cancer is preventable and treatable. Let's glance at the future. On the horizon, we see artificial intelligence, interpreted diagnostic scans. This is going to improve the accuracy of the results of our diagnostic tests. On the horizon, we see artificial intelligence generated treatment algorithms that will be individual specific. On the horizon, we see personalized cancer vaccines. Such vaccine candidates are already currently undergoing rigorous testing, and access to them is limited to controlled clinical trials. Ladies and gentlemen, this is the essence of hope for the future with regards to breast cancer management. I thank you.
So this can stay. Dr. Laws, on behalf of Essence of Hope Breast Cancer Foundation, we thank you so much for all that knowledge. I was sitting there personally and I was like, Dr. Laws is doing such a good job. Thank you. It's a lot of information. But when I looked at the dollar sign, I started getting uncomfortable. That's a lot of money. A lot of money. So once again, we thank you. We surely appreciate you. And on behalf of Essence, to you, there's a token from us. Thank you.
One of the things that I say to most or all of my breast cancer sisters is, let your faith be bigger than your fear. Let your faith be bigger than your fear. My name is Kamara Lee Prentice. In 2018, I was diagnosed with breast cancer. Luckily, it was caught at an early stage. But from 2018 to now, the diagnosis, the journey, it has definitely changed my outlook on life. Now I can say that I am more appreciative of the finer things in life. I take certain things more seriously, such as my health. Too often as individuals, we say, man, I'm going to do that another time. I prioritize everything when it comes to my health. And now I have a different outlook when it comes to people and life. I value people more, not that I didn't before, but it's different. It's a different feeling when I am connected to someone. I care, I pour into that person because you just never know. In 2018, when I got that diagnosis, it gave me a curveball. And from that point to now, my outlook has just been different. And so I value moments, I value people, I cherish the moments because you just never know when life is going to throw you that curveball. Navigating life after a breast cancer diagnosis, treatment, or any form of major diagnosis is certainly not easy. It's like a relationship that you have to own and live with for the rest of your life. There are little things that will pop up here and again, but your mindset is very, very important. So for instance, a diagnosis, a cancer diagnosis or a breast cancer diagnosis doesn't have to be a death sentence. Acknowledging what it is, being proactive in getting treatment can make can have a major impact on your outlook and how you go forward. So having a positive mindset, I am going to get through it. Affirmations, I am going to beat this. And you will find that that positive mindset, that positive outlook will eventually help to improve your overall outlook on life, such as when things pop up, you know, looking at it in a positive way as opposed to a negative way, not taking certain things for granted, being proactive and present in your life and others' life, people who are important to you, and encouraging people to make important decisions in their life for certain reasons such as health and just for an overall better life. I can think of many instances, but if I am to choose one, it will be at the end of my journey after completing all of my chemotherapy treatments and going over all my scans and blood work and so on, and to hear, Kamara, you are cancer-free. Now, for me, that signaled that persistence, being proactive, having a positive outlook, having hope, faith, trust in God is very important when you're facing any crisis. And so that one moment that I'm going to choose in this instance was at the end when I heard those words. For me, it said to me that I did not fight in vain. It was important for me to push harder. And I'm not going to stand here today and pretend as though the journey was easy, because it was not. I am human and I had several low moments. There are times when I didn't want to get up out of my bed, but I remained committed to the fight, and at the end I was very thankful for the outcome.
As we move along, we will get into our first dialogue, which is entitled The Road to Prevention, Early Detection and Education. So I will invite our panelists to come forward. In this first dialogue, we have a group of medical professionals who will delve into a little bit more of what our CMO, Dr. Laws, just mentioned regarding early detection, as well as educating ourselves on breast cancer and other forms of cancer. Before we jump into it, I will ask our panelists each to just introduce themselves very briefly and their job titles, etc. So I will start on my immediate right, Dr. Leon.
Hi, good morning. I'm Dr. Leon, medical oncologist, working at Janet Hospital and privately too.
Good morning. My name is Valencia Wallings. I'm the assistant nurse manager from the oncology unit.
Good morning, everyone. My name is Clarice Yanato, and I'm a senior radiographer and mammographer at the Joseph Daniel France General Hospital.
Thank you very much, ladies, for agreeing to be on the panel, and I just asked Dr. Leon to jump in as well. So thank you very much. And we want to just jump right into it, and it's just a very comfortable discussion, I hope, for each of you. And thereafter, we'll have a short, what we call engage and enlighten session, which is a Q&A where you can ask the panelists some questions. So I want to start with Ms. Nato first, who is a radiographer at JNF General Hospital, and ask about our mammograms here in St. Kitts and Nevis, and maybe you can discuss the importance of mammograms as well.
Okay, so presently at JNF, we do have a digital unit. Digital radiography is where we don't use the film at all. We don't use any cassettes. It's basically the machine is hooked up to a computer. So as soon as we take your image, it shows up. Right? So it's pretty quick, pretty efficient. However, we're not fully up and running with it. In the private sector, there are two offices, one at the Science Complex, Dr. Mark Hodge. He also offers digital mammography. And there's Dr. Clark down at Radiology Diagnostic Center. She's located downstairs of the Antioch Baptist Church in Limekiln. She offers computed radiography in terms of the mammograms. Mammograms are essentially the first tool for diagnosis. Now, there are three types of mammograms that you can have. You have your baseline mammogram, which is the mammogram you do at the age of 40. It's your very first mammogram, or it's the first mammogram that you do post-surgery. Then you have what we call our screening mammograms, which are what you will do annually or every 2 years, 3 years, depending on which facility you may go to. And thirdly, we have our diagnostic mammogram. Now, these mammograms are mammograms that can be done at any age. Once you have a symptom, you have a lump, there's a discharge from the nipple, with consultation with your GP, your general doctor, and the radiologist, we will do what we call a diagnostic mammogram. So any female can have a diagnostic mammogram done. Okay, now the procedure is pretty painless. I try to make my patients feel as comfortable as I can, and I try to be very quick because I have breasts. I don't want anybody squeezing my breasts. And we have to compress the breast because we get a better picture, and we also reduce your dose, the radiation dose. If the breast is not compressed properly, the machines sometimes they don't give you an exposure, or the pictures do not come out clearly, and we don't want to miss anything when it comes on to the breast. Now, typically, with a mammogram, we have 4 views. Once you have both breasts, we have 4 views. Because of how the body is, it's 3-dimensional, and when we look at an image, it's only 2-dimensional. We have to take 2 views, basically at right angles to each other. Now, when we do these views, we have to pull on your breast because the muscles that are behind the breast are very important. The muscles that run along the arm, the tail of the pence, which is right here, they are also very important. Now, I forgot about our men. I see one gentleman here and 2 at the back. But men, we also will do a mammogram for you if there is a symptom, but we find that with men, an ultrasound will typically work best because they don't have enough breast tissue to place under the machine. But we have had men in St. Kitts that had breast cancer. And so men, you also have to be vigilant with yourselves as well.
Thank you very much, Ms. Nato. Yes, we, at Essence of Hope, we have actually given assistance and support to men who have contracted breast cancer. So we understand that it is not just a female-only disease. Dr. Leon, if you may, what are you typically seeing in terms of the diagnoses now here in St. Kitts and Nevis in terms of the age range of women? And piggybacking on the mammograms, are you finding that these women have had mammograms or they have never had any sort of mammogram screening?
Well, it's really important to know that we have a lot of women that are diagnosed before the 40 years. That is when we really starting doing a screening for patients. Here we have a population where younger women, the youngest women that I have with breast cancer was a 29 years old age, that usually we don't do any kind of screening at that age. So that is the reason that we encourage people to go and do a screening. They have to go and do follow-up. It's important not only to start it with ultrasound and mammogram. It's important the cell examination for patients. You have to starting to do it so when you have the age of 20. So you can do your own examination in case that you found in the breast that you have a lump, any discoloration in the skin, different shape breast, nipple discharge that are the most common symptoms in this disease. We advise patients to go and check with the doctor. They will they will be the one to do like the screening that you will need eventually, such as, for example, ultrasound is better for younger people. Why? Because they have a lot of mammary tissue, and we can catch something better than the mammogram. And mammogram will be better for persons that are elders. We have to say that people that have more than 50 years also increase the risk for get the mammogram. Last year in October, I did a free screening for patients in my office, and I was surprised because many people show up for the screening, but mostly of them, they don't have any serious condition. That means that still people are afraid the real cancer is in the community. They don't want to go and seek for attention, and we still have a lot of women to come to see us late. It's sad to see that we have a lot of persons diagnosed in stage 3 and 4 still. And we have to know that when the patient come in that stages, it's really hard to cure the disease, right? What we can do is control the disease. We can do palliative care for patients, but eventually the patient will die for the disease. So we have to continue pushing to go do a screening, go see a doctor. I always tell the patient at least one per year to go and do examination with a physician in order to catch anything sooner.
In terms, you're an oncology, yes. So from your vantage point, how important is it for you to educate the patients when they come in about their various options? And what are you seeing in terms of the women who come to you at Jen?
For me, when the patient comes for treatment at the unit, they are scared about the treatment itself. They're scared about what they are supposed to eat, what they are supposed to do, how they are to deal with the families, community. Some of them are even scared that they don't want anyone to know that they have cancer. I always encourage them to seek counselings from the psychologist, and I'm glad that we newly got a counselor just the past few weeks. I also encourage them about their health. They're to stay away from as Dr. Hazelor said, the red meat. Eat more vegetables, eat nuts, stay away from alcohol. And they know then to stay away from these alcohol and exercise more, to speak to their relatives so that they can know how to get help if the nurses and the doctors are not there at that point when they need the help.
Do outside of giving just financial assistance and so on. We also try to educate, as this forum is attempting to do, and educate women. And we find, strangely enough, we have a free mammogram program that many women don't take up unless it's a little too late, you know. And so we want to encourage women. Typically, it's men who don't like to go to the doctor, so it's very strange. But something about mammograms, I don't know if it's the past myths about how it the experience was, or even that it used to be said that you could get breast cancer from doing a mammogram. So I think we are demystifying a lot of those myths, but I still think they're still there. So we get a lot of women who who come to us for support after they feel a lump that is a huge lump, and you know that means a lot of time has probably passed. And as Dr. Leon said, then you know it's a little harder to try to cure the cancer. So we want to encourage women to go out there and get their regular screenings as possible. But Dr. Leon, you mentioned that we are seeing younger women where, you know, a mammogram, as Ms. Nata said, is typically done from the age of 40. So does that mean we have to lower the age when we encourage women to do mammograms?
Well, that is an important question. Here in the Federation, we have a subtype of cancer that is the triple negative, that is a really aggressive type of cancer that most of the time occur in younger people. So my advice is we have to know about the family history of the patient, and based on that, we will start in doing screening for patients at early age. If we have any relative, could be the mother, auntie, anyone in the family who had a past medical history of breast cancer, that patients will need to do a screening early.
All right, definitely. So in terms of our communities here in St. Kitts and Nevis, we are pretty small, and we have health centers in most villages, you know, in close proximity to villages. So are we seeing, and I think this goes back to maybe Dr. Laws's point, and Essence of Hope is really interested in doing a population kind of cancer registry to kind of identify maybe where we are seeing persons getting diagnosed. So if for some reason in a particular village we see a cluster of persons who are contracting cancer, whether it is breast or otherwise, and we map that around the region, maybe we can detect what is happening in the environs of that community. Is it some sort of industry in the area? Is it the type of foods that are typically there, and so on? So I'm wondering from your end, in terms of nurse and Dr. Leon, either of you can maybe jump in on this. Are you doing anything outside of JNF in terms of going into the communities in the rural areas or in the other health clinics to give any education in terms of cancer?
Well, I must have to say that the only program that we follow is in the month of October, when we go to different job centers and we do a screening for patients. But more than that, I think that we have to push more. We have to get more to the community. We have to, even if we have a lot of information right now, because the people have access for a lot of information in the radio, for doctors, that are doing several screening also, but mostly for prostate cancer and other type of cancer. But we can do more, or we can do more.
Well, this is my first year in the oncology unit. So this year, it's not breast cancer, we are doing teaching in the colorectal cancer. It is celebrated in March, but due to circumstances, we are going to be doing lecture in April.
Okay, good. So there's always room, of course, to expand our reach, I think, and you know, Essence of Hope is willing to work with the oncology unit for sure in helping to educate persons further afield than just maybe in the JNF General Hospital or in the local offices of the medical doctors. I wanted to also ask about technology, right? This is 2024. We are seeing things like telemedicine and all of these digital tools. I'm wondering if there are any plans, and maybe I'll ask Ms. Nato if from their end in the radiology unit at JNF, how are you guys planning to maybe leverage technology in terms of not just the actual physical exams or digital exams that you may do, but also in terms of reaching persons to educate them?
Okay. In Dr. Law's presentation, she mentioned something about AI, and AI means artificial intelligence. About a little bit 4 years ago, World Radiography Day was centered around artificial intelligence. This year, there was a study that was completed in the UK, and there's a company called Chiron, and they developed an AI tool that was used to detect some of the smallest lesions on mammograms. So what the AI tool does is that it was built over 6 years. So this is not something that was done overnight. It uploaded millions and millions of mammogram images, okay? And it programmed it so that it can read anything that comes up that looks like a cancer, that looks like a cyst, that looks suspicious. So they took about 10,889 women and did a study. And what they found was that most of the patients were cancer-free. It flagged all of the patients who had symptoms, and it picked up 11 that the doctors had missed. So during this study, the radiologists also participated. So it was basically the radiologist versus the AI tool. So the AI tool picked up 11 that were missed. In the 11, there was a woman who her lesion was about 6 millimeters. That's very small. That's not even a centimeter. And with that detection, she was able to do her surgery, and she only did 5 days of radiotherapy. 5 days. Study has shown that lesions that are less than 15 millimeters, you have a 90% survival rate. So imagine what an AI tool can do for millions of women, right? So we're talking about things that are less than a grain of sand. But in that woman's case, in the UK, she would have come back in 3 years later for her routine mammogram. So imagine how much that lesion would have grown over time. So we're seeing that AI is going to be introduced. It's a work in progress. It's going to be an expensive venture. But once the images go in, we keep updating the AI tools. I'm sure that over time, they're going to break it down so we can get the software, log in, upload it. But we'll still have our radiologists. But it reduces the human error. Because when you're sitting down looking at over 100 images in a day, you can be tired, then your phone rings, and you get hungry, and you miss something. It's not because you're not competent, but it's just that there's so many things happening around you. So not sure if we'll get to that stage here in St. Kitts, but slowly but surely we are getting there. As I said, we do have a digital unit, and the digital unit allows us to change the contrast, right? So we can zoom in, zoom out, magnify, go into greater detail, fine-tune things. So that is already a plus for us. And as I said, Dr. Hodge, he also has a digital unit. So if you don't want to come to the public sector, there's also someone in the private sector. We also employed another radiologist last year. So we have 3 on island. So the work will be shared around. So we'll have people taking their time, being able to look at the images. So in terms of technology, that's where radiology is heading. In terms of lab technology, I know that there's something called liquid biopsy. It's not actually a biopsy, but it's a blood test. And what they do is that there are two protein cells that they take from the original cancer. So this is for women who have already been diagnosed. The test is used to see if we can reduce the chances of the cancer coming back, all right? So what it does is that when you have a cancer and the spread, you'll have the DNA breaking off and spreading through the bloodstream, right? This is called circulating tumor DNA. So the test is gonna take that, see which gene is connected to it, and then based on what gene is connected to it, they can pick the specific drug to use to target that cancer, right? So it's going towards the treatment. So we see technology, laboratory technology and radiology technology is moving towards trying to reduce the risk of the spread of cancer and also to pick it up in its early stages.
With one of my patients that we send in the biopsy overseas to Miami, and thanks to that, we can target the tumor with a specific treatment we don't have in the federation. And right now is a lung cancer patient. He is a survivor. He has been cancer. He's not cancer free, but he has stable disease so far, and he has been like that for 2 years. So it's something that we can do, but one more time, the financial aspect of it is important because the test costs $3,000 US, only the test. So, and that kind of biopsy is only done right now for patients who already have diagnosis for cancer.
All right, thank you very much for that. Now, in my former life in grad school, I did a lot of work with radiation detection and measurement, and so that formed my studies. So I'm really interested in radiation therapy in particular. I am really thankful that we got chemotherapy in country now. That's something that Essence of Hope was advocating for over the years since our existence. So we're very happy for that. So Dr. Laws did mention radiation therapy, and immunotherapy was mentioned by Dr. Tate in the video as well. I'm wondering, what do you think should be the next form of treatment that we should acquire here in St. Kitts and Nevis? Radiation therapy, or should we do something
right
else?
now we use chemotherapy, hormonal therapy, target therapy, and immunotherapy. So we have that 4 modalities that we can do here. And the only one that we have to send in patient over is radiation. So for me, radiation will be really neat in order to improve, the overall survival of the patient. Some of the patients we have that have criteria for radiation, they can afford to travel to get the treatment done. So that is one of the issues, the most important issues right now in the management of the disease.
All right. Thank you very much for that. I actually didn't realize we had 4 modalities. So I'm glad that I came today to get this education. My sister didn't tell me that. But, so I thought it was just chemotherapy, but I really appreciate that. I just have one more question before we ask any persons in the audience if they have questions, and I'll ask Nurse Rollins. So what would be, Nurse Rollins, your advice? I know Dr. Leon talked about self-exams. And our president, Pam, always says, touch up yourself, women, touch yourself, when you're in the shower and so on, make sure you feel for lumps. And so I wonder, what would be your advice, and what do you usually advise women? I know you see them most times when they're already diagnosed, but for those women who are not, what would you advise them to do in terms of their own self-care and self-screening, so to speak?
I would advise stay away from alcohol, smoking, exercise regularly. And still the self-examination, continuous check. Ensure that you do your yearly physical examination. Go to the doctor. Stop being afraid to say I want to go to exam, but have to work, stop making excuses to do these things, because as you see, cancer is here. We don't want it, but it's here. So we have to be efficient, love ourselves enough to be able to say, I'm going to the doctor today to get my examination done. Work is always there. If anything happens to you, you're going to be replaced regardless. So take care of yourself. That is my advice to all of us.
Thank you very much. I couldn't say it better myself. So now, before I allow the panelists to leave, just if there are any questions for them, you feel free to ask at this time.
Hey, good morning. Just a question. You mentioned if you have a lump, if you have a discharge, are there any other effects that you look for? Because a couple of years ago, I had a lump. It was there a long time ago. It never hurt, or I never had a discharge or anything, but I just said, let me go and check it.
We have different symptoms, right? I already mentioned like 5 of them. You can have a change in the shape of the breast. One of them could be enlarged. That is one of them. You don't necessarily have to have all the symptoms. You can have one, and that is a reason for you to go and seek attention for the doctor. In your case, you feel a lump. That is the most common. And most of the time, the patient will be able to catch the lump for themselves. That is the reason we push patients to do the self-examination. Most of the time when the patients seek for medical assistance is because they already know that something is wrong in the breast, right? One of the other symptoms that could happen is change in the coloration in the skin, right? You can have dimples in the skin, you can have red coloration, dark coloration, the breast could be swollen, that is other one. We have also one subtype of cancer that is weird, that is only in the 4% of the patient, that is the inflammatory subtype of cancer, when the breast look like inflate, really big, huge, is red, swollen. Most of the time the patient think that they have infection in the breast and is an advanced state of the cancer. We also can have discharge for the nipple. That is also one of the symptoms you can have, but the lump is the most common presentation for breast cancer.
I'm just going to piggyback on what she said. As a mammographer, we always encourage our patients to do the self-breast examination, and I found that over time, women think that a self-breast examination is just touching their breasts. But we also encourage you to look at your breasts, because not everything can be felt. That's one of the reasons we want you to do a mammogram. Things are very small, you can't see them. Doctor mentioned some of the things to you. So you look at your nipples, right? If they're sunken, if they're discolored, looking crusty, flaky, you can have a growing vein as well. What she mentioned with inflammatory breast disease is what we call pur de orange. You can have your breast looking like how an orange skin looks. It has little holes in it, and it has that smoothness looking like the rind of an orange. So there are many things. So when you do your breast examination, some of us have big breasts, and even those of us who have small breasts, we can't see under our breasts. So you also have to move your arms. You can't just look in the mirror, and you can't look down and see everything as well. So you stand in the mirror, you put your hands up, you look. Put your hands on your hips, lean forward, you look, right? And you also put your hands over your nipples, lift them up, and you look under your breasts. So that is the self-breast examination. And we encourage you to do that once a month. Usually you do it 7 to 10 days after your period. Or if you don't have a period, you choose a day in the month. I usually tell patients the first day of the month and the last day of the month. It's easier for you to remember those days. You do your breast check. And you do your clinical breast examination checks with your doctor or your nurse at your health center once a year.
Thank you. I I have a question from someone online who asks, is BRCA genetic testing available here in St. Kitts and Nevis?
It's not available right now. Usually we send in samples overseas to get testing. She referred to BRCA1 and BRCA2 gene mutations.
And maybe just for us, you can explain what BRCA genetic testing is and what that does.
Well, that is one of the genetical mutation that could happen in patients. Usually, the patients who carry this mutation, they are in risk to have breast cancer, ovarian cancer, and colon cancer. So it's really important. Also, this gene is linked to prostate cancer in men. When we have this test positive, the most important is for us to choose the treatment plan for patients. The treatment that that patient will need is olaparib, that is not available in this federation. So that is an important mutation, and maybe we can work forward to get that done here. I know that they was trying to implementing the testing, the immunohistochemistry test here by Jeffer Lab, but still is in progress. So mostly of our patients, we need to send in sample overseas. The costing for that is around 500 US.
All right, thank you very much. Questions?
Dr. Laws, I know you're not on the panel. This could either go for you or Claire. When someone is diagnosed and has to do a mastectomy, is there anyone at the hospital who can walk them, through this and the aftercare of what is supposed to be after having a mastectomy, the after plans or what it is, because it's a lot of stress on a woman mentally, knowing that part of her is gone. So I'm wondering if there's, at the hospital, is there any kind of anyone to talk to or to help this person through?
Okay, so as I said in my presentation, there is the clinical psychologist post at the hospital. It has been vacant for a few months and it was just filled. So we now have a clinical psychologist who can be called upon to whom such a patient should be referred. Because as I said before, psychosocial therapy and support is critical for improved outcomes for persons with this diagnosis. And again, your question also underscores the need for a multidisciplinary approach to the management of such persons. So in other words, the surgeon will have his or her input, but the radiologist, the oncologist, all the key health providers should be seated at a table to discuss my care if I'm the patient. And so the patient will be the center of everybody's attention, and all the aspects that the individual needs to look out, for will be addressed. So it's not just one doctor's responsibility, but the team's responsibility. And again, in my presentation, I mentioned that if we were to have like a case manager or a cancer navigator or facilitator, that person also could play such a role to help the woman who just lost her breast, to help her to navigate that space in terms of how do I move forward having lost my breast. And so that's a post that I'm going to be advocating for going forward, a case manager or a cancer facilitator that would make it so much easier for our cancer patients. So probably the next budget cycle, I'm going to try and advocate for that.
Well, about that question, we have currently 4 patients receiving counseling at the hospital. We know that eventually everyone with this diagnosis will need a counseling. because this affecting psychological, physically, emotional, so much to the patients and also to the relatives, because this is a long-term disease. It's not that you're gonna have this disease only for 2 years, 3 years. This is for the rest of your life. And mostly of our patients, they struggling to um, face the diagnosis. We have right now 3 patients, 2 of them really young, 36 years old, with depression. They see the patient usually 1 per month, but we need to do more. We need to do more for these women, for all of them, because some of the patients, they hiding, they feeling, they don't express themselves. We don't even know that they have depression. So it's important to tell your doctor how you're feeling, what are your fears, and we can, do coordination for patients, do referral to get the proper assessment of the patient.
And also the psychologist comes into play also, because some of them, they are scared of the chemotherapy because someone they knew had chemotherapy, they've been through these symptoms, they're wondering if they're going to get these symptoms, if they're going to feel the same how that person feels. It doesn't mean, if you have cancer, it doesn't mean that I'm going to get the same symptoms that you have. Everybody is different. We're diagnosed with the same cancer, but we are all different in makeup. So they also need counseling sessions for that. Okay. Some of them reach to the point that they want to stop the treatment.
Sorry, Pam. Yes, they do offer counseling to the patients right after, meaning post-op, before they're discharged. Usually they're visited by someone from the psychology unit. But I don't think there is continuous counseling or treatment from psychology unless they realize, as doctor said, the patient tells you they feel like they're depressed or whatever. So I think maybe that's where the gap is, having continuous counseling, because when you go home, you're home by yourself, nobody is really calling you until you go to your next doctor's visit. So that is where the gap needs to be filled. Sorry.
Thank you, and good morning, everyone. My name is Dr. Glenville Lai, but I'm from Nevis. So I took a day off to enjoy the other half of the Federation, and I like the name of your NGO, the Essence of Hope. And one of my experiences as a practitioner is that we sell hope, right? If patients come to you, they're already in fear. And the first step of healing starts with changing the mindset that, yes, doctors going always give bad news, and they don't want to come to doctors. But they come and they have no other solution left to know what's going on. And so I've learned that too. Yes, it may be bad, but there's a way. There's a solution somewhere, and just try and discover that solution. And as the health system goes, I like what I heard from the CMO, that they're looking at the different navigating to the maze of health providers that exist. Patients get confused, they get lost, the care gets fragmented. And as a person who works at primary care level, they come to me initially, I send them to the specialist, and they come back empty-handed. And so that referral back and forth needs to be developed. Yes, I take my time, I copy lab results, and I send it to the specialist, but nothing come back to say, well, this is the treatment plan. This is how we need to manage the care. I will say them every 6 months. You can look for these things in between. So we need to have that health system communication process going on so that patient doesn't get lost. And when they come back to the primary care practitioner, whoever they are, that there is some knowledge. Patient doesn't know the technical details of what the specialist will tell them. Yes, they hear something, but they are often confused, and they will report back to us half the story and give you a bad name, give us a bad name, back and forth. So we need to understand that dynamic. So I'm thankful for this forum this morning, and I made it my business to be here so that I could add my voice to the conversation. Thank you very much.
Thank you. We have 2 more questions. Yes.
Good afternoon. It's not really a question, but my name is Brenda Clark, aka Sister B. The 3rd of next month's gonna make me a 15-year breast cancer survivor. And sitting here and listening to the different information given this morning is so different to when I was diagnosed. Because we didn't have these. A matter of fact, when you talk about counseling, I had to go to Nevis by Pink Lily in Nevis and spent, I think it was 2 weeks over there to get counseling, from her, because we didn't have that at the time. In my time, I the one that found my lump. And when a matter of fact, I was in Antigua on vacation and I felt it. And I decided I come at home because at the time you didn't hear about breast cancer like now. The only person I could remember talking about breast cancer was Ann Liebert. So then the thought came to me, and then I say, I want to go home. But when I went to the airport, they told me I had to pay 100 US in order to change my flight. I said, okay, I had another week, so I'll stay. And when I came home, I went to the doctor, and I went for a mammogram. But when I went for the mammogram didn't pick up the lump. But I was feeling the lump. 8 months after, a black spot came up, and I went back to the doctor. He sent me back for a mammogram. That's when they found out. And I remember Mr. Hodge saying, wow, where was this 8 months ago? That's how I knew it was 8 months before I went. So it took me another 8 months after actually feeling the lump to really realize, for the doctors to really realize that I had that. But I didn't waste any time. I went to the doctor, took out the lump. The pharmacy 2 weeks after, the Friday, he met me on 4th Street and he said, Brenda, come to my office tomorrow, which was the Saturday. So I went home and when I started to, but then I said, it could be good, it could be bad. I went to him and he told me that the results came back and it was, what the word name? No, not positive. The medical were malignant. And I said, what that means? So he explained to me. And then I said, right there and there, I said, so what is it? He said, it could be, you could take out the lump, we'll treat it, give you this, that, and I said, any other? He said, yeah, you could take it off. I said, well, I'm going to do that. He said, no, bring somebody with you. And he said, I said, I make up my mind right now. I ain't got husband, boyfriend, whatever, and it's my life. Because I kind of fidgety now, eh? And then, so anyway, Monday, I went back with my daughter. And she said, well, my daughter said, well, she said she's going to take it off. She's going to take it off. And I went the Tuesday, paid my money, went in the hospital the Wednesday, took it off the Thursday. In a week, everybody does say, I'm crazy. He and I say, Brenda, you didn't seem to amaze me because I didn't waste no time because 8 months done gone already. And I did that. And I'm saying all of this to say, right now, we have the allergists, whatever allergists. And, and we have counselors, and we have people talking about it now. But in my time, there was nobody talking about it. But as I said, just because I heard and people used to say, oh, she, whatever and whatever, the breast cancer thing came to mind. And here am I, 15, going on 15, and then 2 weeks' time, years after, without all those load of, and I just, a matter of fact, Pink Lily gave me a chart with the same stuff, eat the greens, do your exercise, blah, blah, blah. And I am here this morning to give God thanks, to know that I'm here. And I heard something there, and I have to go and check it out with something that you could go back, because you had one, you could go back and take another examination to find out. So I'm just going to talk to somebody to let me know exactly how to do that, because I find nowadays I just find some tingling in my breast and I just kind of get fidgety. But I'm glad to know that we had reached this far. And I hope that people out there take advantage of it, because as I said before, I didn't have those kind of areas to go to and to find out this and find out. So now that it is here, I don't understand why the young women them are afraid. Why they are afraid. We're saying that the government have to go out and tell them, but the young ladies themselves have to be responsible for themselves, and they're hearing about breast and breast cancer. And if they have a fear, they themselves should take it on themselves and go and find out, oh, hearing about this breast cancer. Let me go and see. You understand? So it's a two-way street. You have to go, and I just talk to people about it. When they say, you ain't look so, and I show them, and I say, see dear. They say, but if you didn't tell me, I wouldn't know. But I'm glad that we have reached this far, and here in other stuff supposed to come and so on. So I will talk to my daughter and my granddaughter and my friends and whatever and say, listen, you ain't have an excuse now. There are facilities and there are places and other. It wasn't like in my time. So I'm very glad to know that it's more, you'll diagnose much quicker and you would get more treatment much quicker and better than in my time. And if I could have survived up to 15 years without these kind of things, I think they should really come forward and take advantage of these areas where they can go and see about themselves.
One more.
Good afternoon, everybody.
Good afternoon.
I just wanted to ask about, I think it's fibrocystic breast, something like that they call it. So what is the recommendation for persons who would have that, they have lumps in their breast? Is it that they have to do more frequent screening instead of an annual screening? What's the advice?
So the fibrocystic disease is a benign condition in the breast, usually happen in younger patients, and is a hormonal condition. Most of the time the patient cure after the menopause, and the gold treatment for the disease is surgery. If you have any lump in the breast, that have to be removed by surgery. All right, you must have to do follow-up with ultrasound is what we advise. We also do recommendation for treatment with vitamins and so you have to go and see any doctor. You can go and book an appointment and we will tell you what to do. But it's not cancer.
Evening primrose oil too. That helps with fibrocystic breast.
Castor oil.
All right, Dr. Laws wanted to make an
I
intervention.
just had an additional comment with respect to the need for counseling and psychosocial support, that it shouldn't be just one-off. We shouldn't wait until the person with the diagnosis is really experiencing and exhibiting serious signs and need for this. And so in the costing, I costed it for a year at least in the initial stages. And so I want to use this opportunity to advocate to the providers, insurance providers, do you cover for that? Because the woman would have to pay the counselor, the clinical psychologist for that visit. So I'm hoping that that's covered.
Thank you. Thank you very much, Dr. Laws. So we'll seek to answer that in the next dialogue that we have coming up. So I want to thank the panelists for their time and for their advice. Thanks so much.
Thank you.
Faith and patience is my best friend actually came up with that. Because on my journey, it's like first when I started the treatment, I just wanted to know what it was about, get it over with. Like start and get it over with. And then she was like, no, you gotta have faith and patience. And then she used to be like, don't look at the staircase, the mountain. One step at a time, you're gonna get to the top. My name is Alicia Percival. To be honest, my best friend, Devon Thomas. She was really, really there in terms of going for treatment, doctor visits. Actually, when I found out first about it,
she went doctor with me. When I found the lump, went by the doctor to get examination, and then she referred me to Dr. Woodley, and then she was there, got my results. She was there holding my hand. After that, to Tate, she was there. Hospital, she was there. The only time she wasn't there was when I traveled for treatment, but then she was still there, but via phone, you know. So she was always there, and through my journey, she found CMOS. You know, she discovered CMOS and its use and benefits, and yeah, that's her business. Currently, I'm doing a treatment. So once I had no tough days, but before, it was like a family. You know, I was like, you got to go through this. You know, you got to get through this because of them and my son. Most and foremost, my son. You know, because he ain't took it lightly, so I know I had to push for myself and them, because they wasn't ready for that. It was tough, real tough, mentally, physically, emotionally, real tough. The advice I will give to someone, like, honestly, don't give up. Keep fighting. There is hope. Once you set your mind mentally and accept what it is you have to deal with, you could overcome it, along with support. Once you got the right support system, you'll be fine and do what you know you're supposed to do. My sister, she's a Christian, the eldest one. The second one don't go to church, but the first one, she's a Christian, and you know, she pushed me to go church. You gotta find your faith. You gotta put your faith in God. Cause like, as small as a seed, yeah, that I found faith, strength, courage, all of that along my journey. You find strength because you never know. You know, you learn to fight and push. You know, because then you gotta motivate yourself. Be like, you could do this. You could get through this. You know, you gotta be your own support system at first. First and foremost, be your own support system. Cheer on yourself. Be your own cheerleader. And then, anybody else coming along, that's even better.
All right, so now we will have our second dialogue. This one is entitled The Current Landscape, Challenges and Opportunities. And this is where we invited healthcare insurance providers here in St. Kitts and Nevis to come and be a part of the panel, as well as medical professionals. So we can discuss what is exactly happening right now in St. Kitts and Nevis and how can we improve both the medical side of things as well as the health insurance side of things. So again, I would ask our panelists to introduce themselves, and we do have one person who will be on Zoom, Dr. Al Pierre, and I will let him introduce himself thereafter as well. So I'll start with Dr. Leibert.
Hello. Okay, good afternoon. Yeah, so thank you very much for inviting me to be part of this panel, this conversation. And as I said earlier in the first dialogue Q&A that I am a medical practitioner based in Nevis, from Nevis. I say I span the entire spectrum of the medical practice, from primary care to tertiary care, quaternary care I do. Anesthesia, critical care, and I also involved in rehab and the primary care. So in Nevis, you get to be a jack of all trades. And so I'm pleased to be part of this discussion. I say I'm being part of several community groups in Nevis, the Pink Lily Foundation. I was part of that group when it started. The founder consulted me and was part of the brainstorming session for that. The Kidney Renal Society and a disability group, which I am also aligned with. And so, as a medical practitioner, I see one of my roles is to empower my patients. And that can only best be done through community groups like A Sense of Hope. And that's why I'm passionate about being part of these forums. It gets me out of the prescribing medication, but prescribing better living standards. Right? That patients need each other, need their family, need the wider community. And this community support is important. Yes, the doctor will do the technical detail, but you need to go back to your families and learn to live with each other and support each other. And so that's why I'm pleased to be part of this conversation, so that we build better support systems. I think I'm going past my introduction, sorry.
Thank you.
Yes. Good afternoon, all. Afternoon. We are Sagicor. We represent Sagicor Life Eastern Caribbean, Inc. My name is Denrick Connor. I'm the agency manager and head of sales of that institution. And with me, I have...
Good day, everyone. I am Terencia Gomes Williams, Senior Advisor.
Good day. I am Danal Katimir, and I'm a Junior Advisor. But I am very happy to be here today because this is something that is very important to not only us at Sagicor, but of course, the entire population.
And we're indeed happy to collaborate again with the Essence of Hope Breast Cancer Foundation. On an annual basis, we do collaborate with this institution in the fight against breast cancer. And we have committed to continuously supporting this effort here in the Federation of St. Kitts and Nevis. You see, our corporate vision is to be a great company committed to improving the lives of the people in the communities in which we operate. And by participating in this forum, we are aspiring to ensure that we could seek to fulfill one of our corporate social responsibilities here in St. Kitts and Nevis.
All right. Thank you so much. And Dr. Pierre, who is online, can you introduce yourself quickly for us?
Yes, good day. Hello. Can you hear me?
Hearing you well, yes.
Perfect. All right, thanks. I want to say first of all, thank you so much for such an important conversation. The work of the Essence of Hope and organizations like yourself, especially in the Federation, I certainly think the impact is tremendous. So thank you again for this. I'm Dr. Al Pierre. I've been in the practice of medicine for a little over 2 decades now. I've throughout the Caribbean as well in the United States. I'm now the director of health services at Ross University, but I also worked at Gwinnett Hospital and I'm also the vice president of the St. Kitts Nevis Medical and Dental Association. I think like everybody else, there's two sides of this. I think we as practitioners have that interaction or relationship with cancer or cancer patients, but also as well in our personal lives. I don't know that there are many people today who haven't either themselves or somebody very close to them go through. So there's two sides of this coin. And I certainly think that it's a good conversation, and I hopefully it propels beyond this room and certainly begins to cause us to look at new and innovative ways. And I heard some really great things coming up from the folks who were on the panel speaking about what's in the pipeline in terms of technology. So I think it's for a very good conversation, and hopefully something good comes out of it. So thank you.
Thank you very much, Dr. Pierre. So we'll jump right in, and I wanted to maybe start off in in this way. When I think I mentioned earlier that Essence of Hope, we have a free mammogram program. Now, whenever persons write to us and request that and we ask them to fill out a form, we have a little area there that says, do you have medical insurance, for example? And 99.9% of the time, they do not. They do not have health insurance. And in our conversations with many persons, their companies that they work for offer some sort of healthcare package, but they have opted for whatever reason, maybe financial or otherwise, not to jump into that. And it is only when they are diagnosed that they then seek to get some sort of health insurance coverage. So for maybe I'll start with Mr. Connor. What are you seeing? Are you seeing that those sort of things in your field where persons come like when they already have what I guess you call a pre-existing condition or something is ailing them? And how are you as Sagicor trying to maybe reverse that sort of trend?
Right, thanks for that question. I will start by saying that the institution of life and health insurance is not a charitable organization. Persons will turn to an institution like Essence of Hope when they would have already been diagnosed with cancer or any other, well, cancer in particular, for assistance, financial assistance. With Sagicor, we provide that opportunity for healthy persons prior to them knowing that they have a condition, that they can take that calculated decision to transfer the risk of financial loss to Sagicor by buying into medical insurance so that when they are diagnosed with a debilitating condition, they know their finances will be very well taken care of. And we do find persons coming to us seeking to get insurance for cancer and other conditions after they have been diagnosed. But that is too late. We cover you during the time when you are free of these diseases, so that in the event, just in case you are diagnosed, your financial situation will not, the finances that you will need can be made readily available by Sagicor. And you would have heard the good doc indicate the expenses that people can go through if they are diagnosed with these conditions.
Good day. What I always encourage persons, do not wait until illness comes knocking at your door. It's best to get insurance when, what we term it as, when you're insurable. Basically, as I tell persons, you cannot go to, let's say, an insurance company to insure your car and say that you're looking for comprehensive insurance. If that vehicle is already past 10 years, you know you are not going to get coverage for comprehensive. It means that you would have to go third party. So once you're in good health, you're insurable, then that is the time to come in and get insurance. Sometimes persons may have a specific illness. I would just make it broad and not base my conversation on just the breast cancer itself. But sometimes person can have a specific, or what we call an existing condition, and that person, based on how far or how they're exposed in their illness, they may be able to get coverage, but it means that they will be rated. They now have a higher premium, whereas you may only pay, let's say, $100. By now, a person where they will be rated, they may pay $500. That's a vast difference. So as long as you're in good health, you're insurable, that's the best time to get insurance.
And maybe I'll go to Dr. Pierre next. As a medical practitioner, you and Dr. Leibert interact, I'm sure, with the health insurance providers from time to time. What are maybe some of the challenges you think you face in that interaction, and how can we seek to improve that relationship, so to speak? Dr. Pierre.
Yeah, thank you for that. And it's a very interesting dynamic because I listen to the insurance providers, and some of the concerns around individuals not really having any or sufficient coverage, and essentially trying to get their card after it's perhaps written off or not curable. That's very interesting. I certainly think that the experience, what we may have some work to do, because I also have been in a situation where individuals who have coverage, I think it's been, and it's not dissimilar to St. Kitts. I think in all my years of practice and all the countries I've practiced in, it's always been a real battle trying to get insurances to deliver on what is the expectation that is set when those plans are being negotiated. So I'm very I have sat and I've spoken to a lot of insurance companies, and I'm pleased. I thank you. Please correct me and keep me honest here on this. But I also recognize the challenge that they face. Very small risk pools, right, in the market in which they operate, but also the cost of providing care for the individuals in those pools. So as you look at the risk pools and you have a number of individuals who are already carrying some type of disease, it becomes a very difficult thing for insurance to actually meet the cost. And I think Dr. Law spoke to the cost of the average cancer patient, but it can rise to significant figures above 200,000 US dollars, or sometimes even above $1 million, depending on the type of cancer and the type of treatment that it requires. So I certainly think, again, I'm not here. I think we have to have a very open and honest conversation as to why patients are not inclined. But many patients, when you speak to them about why they haven't taken insurance, it's really not about for them a necessary evil. A lot of them feel that it's almost as if you bought an umbrella, and then when it rains, you're really not sure if you can or how you should use it, and that becomes very difficult for an individual with cancer. Where one of the things that has been, I think, that has been cardinal in terms of what everything has been spoken about is the time sensitivity around it, the time sensitivity and the mental health concerns in terms of just walking into a doctor's office and getting a lump diagnosed and getting the mammogram and getting that and walking out of that office not knowing where to turn. And I've been there, and in terms of people who I know personally outside of my sphere of medicine. And then the next thing, before you can start fighting the disease, you're fighting with the insurance companies. And that I think is a challenge. And I'm not sure what the solution is. I can be prescriptive about that. But I certainly think that there's a case to be made as to why patients are reluctant. And I think there is some work that we all have to do to ensure that we revisit those plans. And I think we can speak again. I don't want to hog the mic too much, but I certainly think there's a way for us to have that discussion that we can find some middle ground.
All right, thanks, Dr. Pierre, and I'm hoping that this forum forms the impetus for those further discussions that you're speaking about. Dr. Leibert, I don't know if you wanted to mention anything on that in terms of what Dr. Pierre said with the reluctance of persons to sign up for insurance.
Well, certainly, I mean, as a patient advocate, because providing a service, yes, you have to help the patient to seek healthy behaviors, and you encourage them to become active in educating themselves about learning their condition. But part of the healthcare dynamics, the healthcare economics, is the financial management side of things. And putting aside something for the rainy day concept needs to be, instituted, either by will or by force. I'm old enough to understand the value of the St. Kitts Social Security Fund that has, been developed over the years, so that when people have a disability that they can't work, there's a pool of income replacement that they can get from Social Security. And the concept way back then was that people who were making good money in their middle life, then when they get old and can't work, they were paupers on the street. And the government of the day created the National Provident Fund, which evolved to become Social Security. And the discussion then was that people didn't want the money to be taken out when they're working. They want all the money at once, right? But they mandated that you must contribute so much to the fund. And now we see people who are self-employed. They were barking at it as well. And in the mid-90s, they had a self-employment contribution, provision for the Social Security Fund. And I work for Social Security, so they come to me to evaluate the medical claim when they're making a claim for disability benefit. And you encourage people to, yes, it's a good thing, contribute to the fund while you're working so that when you can't work anymore, you can get a replacement income, either through sickness benefit or through disability benefit. And so this mandated savings scheme needs to be considered by the country as a whole. And I'm glad the CMO is here because I've been back here now for 27 years, practicing in St. Kitts and Nevis. And since I came back home, OECS and CARICOM have done studies as to the National Health Insurance Fund. And after 27 years back here, it is still not implemented. We have had consultation after consultation that the government has been failing the people of the country to implement that social protection provision because you never know when you'll have a cancer or major trauma and you have to have expensive medical care. Yes, we preach prevention, but you have to make provision for those who will fall to the net. And these funds are there for that purpose. And so we don't have to reinvent the wheel. Social Security is there. Statutory and statutory name, but private insurances are there to make a profit for the shareholders. And so they have to manage the risk aggressively. Government is there for all of us. And so we need to look at government's role in managing insurances portfolio and how care is provided for the entire population. So that's my take today that, as Dr. Pierce says, people are reluctant to private insurance because when they invest in an umbrella and the rain comes, it is taken away from them, right? And those are real experiences. And not everyone could fight a mega company like, insurance companies because they have more money than the small man. Yes, they come to you, say, okay, come, we're going to give you this protection, but then when they come a claim, they do a screening test. And because they have no diagnosed illness, the claim is not honored, right? And we encourage them to do screening. But then when they get wellness check, the claims are not honored. So these are things that the insurance company needs to be aware of, that they are hurting themselves by not encouraging wellness checkups, preventive health care. So that's my take, and I hope that we can have a robust conversation on how we could all work together to make it happen. It's not rocket science, it can be done.
Definitely. Mr. Connor, I don't know if you wanted to respond.
Yes, I'd just like to respond to one part of what the good doc said. Our medical plans, a big part of our medical plans is preventative care. And so built into our medical plans, definitely persons can practice preventative care where you go to the doctor. And matter of fact, it's not applied. Your deductible and co-insurance is not applied, okay? You actually get 100% coverage for preventative care in our medical plans.
These things should be highlighted so people can come early because, people always come when they sick. But we need to get it in the society consciousness. Look, don't wait until you feel symptoms to come and get checked out because I think people, when they get symptoms of cancer, it's too late because there are tests that are now available, as we heard earlier, where you could do preventive diagnostic testing by screening appropriately according to this science that is already developed. So these things need to be highlighted at a community level to education, and Essence of Hope and other NGOs can play a role in that regard to mobilize the community to become part of these groups so that we have that, communal.
Okay. I think Ms. Casimir wanted to jump in. Yes.
I think there are lots of misconceptions that are out there in regard to insurance. And one of the things that I've noticed coming into this industry is that as a nation or our culture, there are a lot of things that we do not encourage young persons to do. So whilst we speak about persons coming in, when they have a diagnosis, we need to appreciate that we do not educate our young people on the value of taking personal responsibility for themselves. We do not want our young people to think that they can just depend on the resources of the country. We want to encourage them. You start working, you have a salary, you should start putting something aside towards your medical care, your savings, and that type of thing. And so, what I've found is that a lot of young people, their focus is on partying. That's our culture. That's what we encourage. So we have a lot of people that instead of focusing on their personal growth, they think a lot of what is the government, what can I get from the government, what is it that I can receive from certain things that the government will offer. But we do not encourage them to take personal responsibility for their own life and their own future. As a parent, you should tell your child when they start working, it's not just about buying a car. Your first thing should not be to buy a car. Before the car, you need to ensure that if you're working, you secure your salary, or you secure that income by getting a life insurance. Not only that, if your job, and a lot of people depend on a job to afford them the opportunity of having a medical. If you're working, you want to make sure that some of that money is going towards a medical. So I think a lot of the problems that we have starts from schools. It starts from us as parents, because we do not educate our children properly. We do not educate ourselves as well, because we listen to a lot of things that other people say. A lot of people, when they tell you why they don't want medical insurance, it's not because of a personal experience. It's from something that they have heard from another person. If you ask them what their experience has been, did that happen to you? No, it didn't happen to you. That never happened to you, but you heard that other person tell you. Did anybody share what medical insurance how they would have benefited from it? A lot of times we don't hear the stories about benefiting, but we always hear the negative things. So I think that as a society, we really need to change that perception, and we need to educate ourselves properly how things work. So as the doctor said, yes, the insurance company should explain certain things to person, but we have a personal responsibility as well. If you're going into an insurance company, you want to sign up for a medical, you need to find out what it is that you're actually paying for. As an advisor, I will explain everything to you, but if you don't understand something, you have the responsibility to ask a question. And don't ask a question to the person on the street, because the person on the street is going to give you their opinion. You need to ask the persons that actually know what it is that they're talking about. So my take on it is that each and every one of us in here has a personal responsibility from a very young age. Unfortunately, some of us don't get that from our parents. We don't get it from home. We don't get it from the persons that should be telling us or should be encouraging us. And so we have to really take it upon ourselves to find the right information from the right sources and not encourage propaganda or misconceptions.
Thank you for that. I see Mr. Quinn
If-
Martin. Yannick.
Okay.
Quinn walked in. Yannick Martin is here as well from Sagicor. They're both, I didn't realize that.
If you allow me to just chime in, Dr. Nat,
Yes. Sure.
Yeah, I wanted to, because I just listened to the last intervention regarding education. Listen, I understand that. I think the idea, and I think where we've actually run into problems, is the idea of people educating themselves on things that they poorly understand. We have a responsibility. I think 2 decades of medical practice. I recognize why shoving information down people's throat, especially at a time when people have more sources of information coming to them. In fact, I think a good quote would be, "We run the risk of becoming the most informed society to ever die of ignorance." We have so much information that we don't know what to believe and what to make of it. Ultimately, every company that's successful today has used something called user-generated content. It means that people who look and sound like you, explaining things to you in a way that you understand it. We have to look at creative ways to make sure we get that information in the right. I think life, there's so many complexities and intricacies to life that when you think of where you spend a dollar, which right now there are so many people competing for that $1. Individuals are less likely, a lot of it is impulsive spend. Individuals are less likely to actually put things off for later. But let's not make no mistake. The fact of the matter is that however we slice or dice this, we also have to look at creative ways to look at plans. So, for example, I believe that if we actually improve our public health system, I would perhaps go for a higher deductible type health plan where I can pay for my blood works and my daily checks and so on, but I have a plan that what I pay, the premium is lower, but the time at which it kicks in is for something very serious and significant, like a coronary artery bypass or some type of cardiovascular disease or cancer. Because ultimately, we have to look at things like the burden of disease. Dr. Law showed some graphs, and here's what's very interesting about that graphs. Between 30 and 60 is where most individuals are diagnosed with breast cancer. 30 and 60 mean that you've just started your life, you've just gotten a mortgage. And this is what we see as practitioners. A lot of individuals come to me because they just get a mortgage and the bank says you need life insurance. When you start doing those health checks and doing that blood pressure and pulse in 3 times, you realize the blood pressure is high and there's a diagnosis of hypertension or diabetes looking around, and that's when you're getting your mortgage. All those things are all lifestyle, and cancers are intrinsically linked to those things. So I really think that it takes an all of society approach in terms of where people are spending money, where people are encouraged to spend money. Dr. Leiber spoke about Social Security, but everyone is dealing with the idea that Social Security will run out of money eventually. There's a lot of what you call in St. Lucia, and my solution friend here knows bounce and draw, where you get paid. It's a gig economy. People aren't contributing to the plan. People are getting sick earlier. I have people who are in their 40s on disability, partial and even complete disability at the age of 40. We will run out of money in Social Security. So I think we have to look at what's happening in terms of burden of disease. What is the real cost, the financial cost, the mortality, morbidity figures? St. Kitts, Dr. Laws, I think, spoke to another figure, which is the incidence, 300 something per 100,000. The average throughout Latin America and the Caribbean is 185. So St. Kitts is way higher in terms of the incidence of this condition. Those things speaks volume. And I think that is where, if we're all looking at this in a piecemeal way and saying that people should educate themselves and so on, it's out there, but people don't have a single source of truth right now for where they actually buying information. So I think we all have to get together. I don't think we can shelve this up and say this is somebody else's responsibility. It's ours. Every time we get someone in front of us, we have a job to ensure that we educate them or find someone that they believe in to educate them, tailor our messages. Some of this is, people don't know what deductible is, copay. I even asked a medical doctor, I had to learn those things. These terms are very complex to a lot of individuals. So it takes an all society approach. So I don't want us to live here with the idea that, yes, it's part of their responsibility, but it's also ours to ensure that we explain several times and in different ways until people understand something that immediately when they're buying into it, it is of no value. And when it is of value, they're too worked up and too emotionally involved in the diagnosis to actually understand it. So I think that has to be, that is an important part of it as well.
Thank you very much, Dr. Pierre. I was wondering, in your work, as Dr. Pierre was just speaking about that, how do you then try to ensure that the information you're giving the person that is digestible? Because as Dr. Pierre is saying, things like deductible and copay and all of these things, I've been to Mr. Connor myself to talk about life insurance, and then I go home and I have to try to find the definitions and that sort of thing. And he's very good at explaining. And I think I'm a pretty smart person, but still, so how do you, when someone is sitting in front of you, and especially if, they're already coming in almost fearful as well, right? How do you deal with that in trying to break it down, making it digestible for them?
Sure. So in a lot of instances, what I personally do is I tend to stay away from the insurance language
and tend to give it to persons in a language that they can understand. For example, in some of our life insurance applications, there is a part of the policy that's called paid up to age 65, but it simply means stop paying at age 65. So instead of saying paid up to age 65, I would tell my clients, stop paying at age 65. The language is very important so that persons who are buying the insurance from you can, as Mr. Natta said, digest it more easily. And even outside of the language, the client simply wants to have a sense of trust. So in speaking with the person, it's more than just selling insurance. It's about building a relationship with the person, ensuring that the person can trust you. Because as my colleagues indicated, there is a lot of misinformation in the market and a lot of persons who feel apprehensive about buying insurance. It's not necessarily because they've had a bad experience with insurance. It's because they've heard about bad experiences from someone else. And in many instances, the person that they got the information from did not even personally have a bad experience. They heard it from somebody else. So a lot of third-party information is going around. So in order to instill a certain level of trust in the client, I tend to simplify the language first of all, but to let persons know first and foremost, insurance is not a scam. It's not a trick. It's not something that you would find some fine print about. It's a true thing to literally save your life as it pertains to medical insurance. And I heard a lot of my colleagues speak about the non-insurable part of it, meaning that if you have a major illness, you might become uninsurable. But another part of it, and I think that the doctor might have touched on it briefly, is the price aspect of it. The older you become, then the price goes up. So you want to take out insurance as early as possible to ensure that you can pay the lowest price. So we're focusing on two things. We're focusing on number one, paying the lowest price possible. And the second thing that we're focusing on is making sure that at the time when we choose to purchase insurance, which should be as early as possible, we should do that because the younger we are, the more likely we are to be in good health. So once we look at those two factors, we should have a better understanding as to why it is important to purchase insurance early, and more importantly, as one of my colleagues alluded to, we should ask as many questions as possible. Don't not ask questions and then later on you have to guess and you have to wonder. Ask as many questions as possible and have the advisor explain it to you so that you understand it thoroughly. That's the approach that I take.
Thank you very much. So Queen Martin, I wanted to ask, now, let's say someone has insurance already, medical insurance, and again, this is Essence of Hope, so we're advocating for breast cancer in terms of the treatments and the support there. But any type of cancer, I would still say, because we don't turn away persons if from Essence of Hope when they come for assistance if they have lung cancer or oral cancer or anything like that. So let me just make that disclaimer there. But how do you assist persons in navigating their coverage? Because maybe they took out the coverage some years ago. They never had to use it. Now they're coming to you because they're just diagnosed. So they come in, lots of emotions, fearful and so on. And so how do you help them navigate, their coverage, especially if they, like I said, they don't even recall what kind of coverage they had? And how do you as well help to streamline the process between them and the coverage and their medical professional who they have to liaise with as well?
Thank you so much for that question, and good afternoon to everyone. The first thing is to show empathy, is to recognize that that person is going through a very serious illness, and as much support as I can give as an insurance advisor, I will seek to give that. Personally, I find myself sometimes answering phone calls after 8, after 9, sometimes even after 10 at night, because when somebody entrusts you with the duty of overseeing the insurance portfolio, it goes far beyond just putting a policy in place. It actually means that you have a working relationship with that person where you have to avail yourself to provide not only the insurance service, but also the comfort and the peace of mind that that person paid for. So in essence, the person did not just purchase a policy. The person purchased your time. Forgive me. This is an alarm. It's my phone is actually on silent. 1 second. Sorry about that. So in essence, the person did not just purchase an insurance policy. They purchased your time as an insurance advisor. Now, specifically, when somebody comes to me with that type of diagnosis and they're seeking direction, we have a wonderful administrative team who gives specific guidance on the way that the policy on the health insurance end will function. First and foremost, it is my role as the insurance advisor to pinpoint different aspects of the policy to the client and to ensure that they understand that this particular treatment will be taken care of. If they have to travel overseas, the air ambulance will be taken care of, and to remind them of the deductible, their responsibility to pay before the insurance company comes in and pays its percentage. Beyond that, if there is any specific information that needs to be divulged, we all work as a team. So I consult my administrative department so that the client can get specific and important information as it relates to the ongoing care that they would need to receive. All of this really speaks to a level of care, a level of assistance, and a level of availability that I have been trained to administer to any client who comes to me, not only facing this particular illness, but any insurance situation. So in a nutshell, it's about showing empathy, it's about showing care, it's about working as a team to ensure that the client has the best experience possible, and so that they know, not just feel, but they know that as an insurance advisor, I am working assiduously to ensure that they are well taken care of and they see the best outcome.
Now, my second part was about the intersection as well with the medical professionals, the practitioners like Dr. Leibert and Dr. Pierre and so on, in terms of how do you streamline that process and help them navigate, from the coverage, relaying it back to the medical practitioner and so on. How is that relationship? And, if it's not as smooth as it is, how can we make that a more effective relationship between the practitioner and yourself?
Absolutely. So when somebody gets a health insurance policy, that person receives a health insurance card that they can swipe at many of the local practitioners. So that immediately calculates whether they have satisfied their deductible log, gives them an idea of their percentage that they must pay immediately at the doctor. We also ensure that we maintain close relationships with these practitioners. So if they need assistance with administering any type of guidance to the client in relation to their insurance payments, that could be done in a very timely manner. Also, we provide health claim forms. So if someone goes to a practitioner who doesn't have this swiping mechanism, that person can be given a health claim form from many of the practitioners that they can either fill out on their own or they can contact us as insurance advisors for guidance on how to complete those forms. And again, we can also refer those persons to the administrative department who can sit with them one-on-one and help them to complete those forms. So the process of the person going to the doctor, from the time that the person gets there and they swipe their let me not specify their insurance card, that person can then come back to the insurance company and receive guidance on how they can be properly compensated for the payment that they would have made.
All right, thank you very much for that. I just had another question. I'm wondering, Mr. Connor, are there any innovative approaches or models? I know your company is a regional company. Are there any innovative models that you're looking at in terms of cancer coverage? I know maybe you don't zone in on that. I'm asking if you're looking at anything in terms of breast cancer care coverage or cancer coverage, or have you seen any models in other jurisdictions that we can employ here and enhance our current insurance framework in terms of cancer coverage?
Essentially, our medical insurance plans, they are comprehensive in nature and covers all possible medical conditions, including cancer. So we do not have anything specifically exclusive to cancer care, but cancer care is covered within the realm of the offering of our medical coverage, whether it be an individual carrier care protector medical plan, or it be a carrier care advantage group, because you can actually get your individual plan, medical plan, or you can get coverage under your employer, right? And the plans, again, they're all encompassing. It's comprehensive medical, major medical, provides medical care locally. And if the care is not available locally, we look regionally, Trinidad, Barbados, Jamaica. And if it's still not available within the region, the plan affords you the opportunity to travel internationally, Miami, Puerto Rico, USA, England, wherever the treatment is available. The surgical medical plan makes it available for you to travel there to get your treatment. So whether it's cancer or any other ailment, our plan is comprehensive and of course includes a ambulance that will take you anywhere the recommended location is to get that treatment.
All right. Dr. Leiber, you wanted to?
Well, I want to be a patient advocate, again, as I think I am appointed to by virtue of my doctor-patient relationship. Now, Mr. Connor, as a provider of financial services and management of the portfolio to subscription from your customers, right? Think clearly, sorry, Essence of Hope have access to 55,000 citizens of St. Kitts and Nevis as a group. Will you provide a group plan to Essence of Hope so that all those who want to become part of that group can have the comfort of knowing that they start from early in life through the family connections, that they subscribe to the plan so that whenever the event occurs, they have that comfort that Sagicor as a company who is partnering with Essence of Hope will be there for them, whether it be cancer or whatever other condition.
That's a very, very interesting question, Doc. For now, our plans cover employment groups, companies, other corporate bodies. Once you can show that you are registered as a local legal entity, then you can have group insurance coverage through Sagicor. Any other coverages outside of that, it will be subject to a debate. We will have to find out now what the specific need. We go to a group department, indicate the specific parameters which is required by the group, and then the powers that be, the group department will determine whether or not we can offer coverage for the specific and particular arrangement that is brought to our attention that has a need. But specifically, our group plans covers corporate entities, employee relations, etc., etc.
I'm here challenging you to consider Essence of Hope and similar groups as legal registered corporate entities that have a subscriber base that support the group and the group's mandate.
Yes.
And part of the group mandate is to provide financial support to those who fall prey to these conditions.
So we invite Essence of Hope to make that approach and see where we can take this very, very important suggestion.
That was actually one of the questions there, Dr. Leibert, and also because, remember, at one point, Ghetto Roots Basketball Club, for example, we were trying to figure out how we could get our players insured, because people turn an ankle, all these things, and wondering how we could get some assistance and get like a group package for our basketball club. So I think it's a legit question, and we should really have a deeper conversation on something like that and see how we could cover persons. Very good, and we appreciate that. So I'll bring the panel to a close shortly, but I wanted to go back to Dr. Pierre and just ask a final question. In terms of the insurance coverage as well, we recognize that there are probably some socioeconomic factors why persons don't sign up for their group coverage and all of these, maybe even individual coverages as well. I'm wondering, Dr. Pierre, and I know you're not an insurance provider, but I'm wondering if you can give us any strategies that you think should be employed to really get persons, equitable access? I really feel maybe I should rephrase that, because there is equitable access, I think, but how do you speak to your patients in terms of the importance of healthcare coverage?
Thank you.
Okay.
Again, I want to be clear, and I was very happy to hear, some very reassuring message from Sajikor in terms of just the confidence in which they speak. But while I was on the phone, on the call here, I just did a quick glance at my email, because my experience, for some reason or the other, and not with Sajikor, when I won't go about naming anybody, but my experience does not mirror the level of confidence in terms of, even for individuals who are covered. I asked a medical practitioner, the last 2 patients I helped to evacuate from this country, there was a total of 68 emails between myself and the insurance company. 68 emails, and that's me, taking up that time because I had a vested interest in getting those individuals to a place where they could get care. 68 emails. There were questions that were asked, and they may be legitimate, but certainly does not take into consideration the peculiarities around our own system here in the Caribbean and in St. Kitts. For example, things like electronic health records, where you have a paper chart and those things. There are many things that sometimes that gets in the way of patients getting access to care in a timely manner. There are also individuals, for example, that simply won't be able to pay for it. I can tell you a personal example. The reason why I'm not a plastic surgeon today is because my best friend, we were on our journey to do our residence together. He was doing his specialty in neonatology. His wife is a pediatrician, and one day he called me in the emergency room when we were in the US and said that he hadn't had a bowel movement in 5 days. Long story short, 10 months later, he died. But before he died, he ran out of insurance. So he was Sloan Memorial Catering, and then insurance, he had maxed out his coverage, and the quality of care diminished significantly, and that's in the United States. Some of the things they've done in the US as well is allow individuals to buy either an additional plan or curate their health insurance for those things that they know for a fact there's a risk factor based on, either because they've done the testing, whether it's the Gallery test, and that's what I want to talk about before I leave the call. And they realize that, I'm more likely to have a heart attack or some cardiovascular disease. So I want to buy a plan that protects me for that. The other things I'm working, I can actually take care of those things, and I'll make some emphasis to actually lead a healthy lifestyle. So they buy those high deductible plans. And that's some of the creative things that I've seen insurances do. But in where we live in the Caribbean, it's different in many ways. And I think there has to be an emphasis, one, on preventive care. I think we have to do a lot. We spoke of the BRCA test. I think Dr. Leon quoted some $500. There has to be a way in which, either through subsidies for our government, either through employer assisted health plans. Those are some of the things that I think we have to look at, because I think if we get into all those diseases very early, I think we can make a big impact in terms of reducing the need to actually provide the definitive care that is required. And that's not just for cancers. There's the Gallery test, for example, that's been done, which looks at methylation sites on cancers on individuals, and so on, actually is able to diagnose or at least predict cancer of many types in individuals. In the realm of cardiovascular, for example, there are tests like pro and terminal BNPs, where we can look at individuals, for example, who may have heart failure 10 years from today. HSCRPs for individuals who may have heart disease. So these predictive tests are already available. I think insurance companies also need to stay ahead of what is available out there to help diagnose the patients that they're already providing coverage for. And employers also need to realize that if we don't have a productive labor force, health is really wealth. But it can't be just one sector of our population. I know when the current administration came into office, one of the things that Dr. Drew and I spoke about was, national health insurance. And I know that's still very much underway, but that might be a tough fight with some of the employers who say, well, I have to perhaps subsidize some of this. Would we want to actually increase taxation, put a 4% tax for health? But I think that type of this discussion that we're having right now, I don't have all the solutions, but there are ways in which that if everyone chips in, if we actually diagnose early, if we actually invest in technology and tests and get our labs to actually get on board, and insurances are willing to pay a $500 test to send overseas for a BRCA gene test, mutation testing. I think these are the things that's going to make it a lot more affordable for our population. Really, it is the definitive cost. Whether it's a bypass grafting for a heart attack, whether it's a stent that needs to be put, whether it is a double mastectomy that needs to be taken, that needs to be done, and then of course the reconstruction of the breast. These are the things that are very costly, and I don't know that we can get that given the rate, given what we're seeing right now. Actually, I think PAHO is predicting that at the current rate, if nothing changes, the burden of this disease, of cancer alone, is going to be 67% more than what it is today in 2040. That's 16 years from today. 2040, 67% increase in the burden of disease. So these are the figures. These are the statistics that I look at and say that we all have to chime in, because one of us, it's 1 in 5 people who are diagnosed with cancer every year. 1 in 5 in the Caribbean. And I certainly think that the onus is on us right now to really stop speaking in silos and really get everyone and have us all hands on deck and see what solutions that are workable for our unique circumstances, because they are indeed unique. Thank you.
Dr. Pierre, I think that's a wonderful way for us to close out the second dialogue.
Doc,
but
may I?
Sure.
If I may? Just to add something.
Sure.
Yes, thank you. We would have emphasized the importance of having medical insurance coverage to ensure that in the event that you're diagnosed with any debilitating illness, the SAGICOR is there to assist you financially. One of the person who gave testimony, who said that she was deemed cancer-free, SAGICOR was with that person all along and provided that strong financial support to ensure that that person was cleared of her cancer and had a strong financial partner to stand by. And so it's very important that each and every one of you consider to put in place medical insurance just in case that something happens to you in the future. We also have another very important plan known as the Life Protector Critical Illness Policy, which provides coverage for 21 different conditions, and it pays out a living benefit to the person who had that plan. Of course, you join before you know that you have that disease or whatever. And in case that happens to you, heart attack, stroke, blindness, paralysis, cancer, you are given a lump sum that was agreed upon. What if that person had a mortgage and they are diagnosed with a serious illness? Who pays the mortgage? Well, SAGICOR will pay it, pay out a lump sum to that person should they have had the Life Protector Critical Illness Policy in place. So that's another policy we have. And then the peace assured, in the event you would have already been contacted, had a disease or an infirmity, no matter what condition you would have had, we still provide you with a limited amount of insurance coverage, life insurance coverage, to ensure that you can take care or that your final expenses are taken care of. And we have other plans that can be put in place along the way.
Thank you. Thank you so much. Just to ask if there are any questions for this segment. I see a young lady in the back.
That's me. It's a little humor that I want to just say something. When you're living in the States, or if you go on vacation in the States, between the hours of 10 and 1, all you see is commercial for insurances. That's all you see. I don't care if you're watching a game show, whatever it is, it's insurance. Every commercial, it's insurance. Insurance, insurance, insurance. I want to ask, what's going on? Like we have something here. People are home at night. That's strategically done because old people watch TV or, you know, get in there. They watch TV during the daytime. Here in the islands, we are home in the evening time. So I'm asking if the insurances do not do commercials, infomercials, something, because all the plans y'all are talking about is only if you see a representative or if you have a forum like this that you know about all these things that's going on. Can't, you put a little thing, I know it costs money, but can't you put a little thing on the TV or something so that people can get information being interested in getting insurance? Thank you.
You are so very correct, and we can only hope that this will change within our neck of the woods, because insurance education is absolutely necessary, in particular for persons to have a full understanding as to how they can benefit tremendously from the various different forms of insurance that is available here to us. Of course, there's a cost of advertising, but we have to reach our people that they are fully aware as to what's available and how they can benefit tremendously from engaging a surgical plan or any other insurance provider to ensure that their future is made better through a collaborative effect with life insurance or any other insurance plan. Thank you for your observation. Yes, yes, yes. Social media and all of that. We need a better presence there.
Just a quick question. Well, you kind of answered it in the end. I wanted to know, is there a package that sets up specifically for funeral expenses or bills? Because your loved one might, for example, they may have insurance, but they pass away and there are bills left that have not been claimed, or the funeral expenses. Is there something where a portion of it can come out towards funeral benefits? So like some of the money that is paid in the premium, whether it's 5%, 2% goes towards that, so that at the end of it, if it's a death, it ends in death, that the family is not left with the burden.
Sure. So we have life insurance plans. Let's take, for example, whole life insurance or even the endowment plan. These plans give a payout. I know, but I know. Yes, but I'm getting to the specific one that you asked about. There is a plan that speaks specifically to final expenses. It's called our Peace Assured plan. Mr. Connor mentioned it a while ago, and that plan is very ideal to take care of that, because not only is it a plan that gives you, as Mr. Connor mentioned, a certain amount of coverage, but the good thing about this plan that I want everyone to know is that this plan is what I refer to as an immediate approval plan. What do we mean by that? It does not matter the medical condition you have. It does not matter if you have an illness. Once you sign up for this plan, you are immediately approved. And that is something that I want persons to know. And so this plan is very ideal because it gives you your loved ones, in the event of your passing, a specific amount between $20,000 and $60,000 of coverage. Or it can be what you call indexed, which would mean that the coverage will grow as you stay on the plan, which we can discuss further. So this plan is ideal because it ensures that in the event of your passing, your loved ones will receive a substantial amount of funds that would be geared specifically towards taking care of your final expenses. You might have debts that you owe to financial institutions, of course, funeral expenses, and other expenses that you might be leaving behind. This plan speaks specifically to taking care of those expenses. And what is remarkable about this plan, as I mentioned, is that you cannot be denied. No matter your medical condition, no matter if you have cancer or any other sort of illness, once you sign up for this plan, you are automatically approved and your loved ones will be protected once you are on this plan for a minimum of 2 years. For a minimum of 2 years. Now, if it is that you are on the plan for less than 2 years and God forbid you were to pass away, then the beautiful thing about this plan is that what you would have paid into the plan would return to your loved ones. However, if you are on the plan for longer than 2 years, then the full sum assured that is due to your loved ones at that point in time will be paid out. Well, so yes. So that was so the uninsurable part was with specific mention to medical insurance. That's what we were speaking about before. But this plan that we are speaking about is life insurance, and it's specifically called our Peace Assured plan.
Our life insurance plans and our medical insurance plans are totally separate and distinct. We always look at ways in which we can improve the offering to our clients. So that's a good suggestion that you would have made. Yes. But we do have the Peace Assured plan that no matter what condition you have, we will cover you.
The age
you can join the Peace Assured plan up until age 69, but not closer to age 70.
Good.
Or I think it's 70, but not closer to 71.
So between ages 20 to 70.
Good afternoon. Mike, I'm a bit confused. How does that plan work? After you have passed on, what ensures that your family member covers, after being paid that lump sum, covers all your expenses, that money goes to the expenses?
At the time when the plan is opened, a beneficiary or beneficiaries are noted. The sum assured is determined, as Mr. Martin indicated. The sum assured that you choose is indexed to the cost of living. So every year, the initial amount goes up by 3%. When death strikes, when the insured person passes on, then the sum assured is paid to the beneficiary or the beneficiaries in one lump sum. And usually you can get that settled before the funeral.
But I'm the beneficiary. I get the one lump sum. I take the money and I squander the money and don't pay your expenses. How does that work?
Well,
as the insurance company, I'm the beneficiary. I have credit. I'm alive still. I have creditors, etc. Do I communicate to my creditors that on my passing, this is the beneficiary, and they're expected to cover all my expenses, my outstanding expenses?
You personally can't say to your creditors that. We have no control over you saying that to your creditors. You can impart whatever information you would like to, but we are not obligated to pay to any other person in the world but the beneficiary that you noted on the policy.
I believe that is something that, for those funds to specifically be paid to a particular entity or for the beneficiary to be instructed to pay those funds to a particular entity or business place, I think that's something that you might have to set up legally that goes beyond the insurance company. So that is something that perhaps a lawyer, a legal person might have to instruct you on to guarantee that those funds get to the destination that you want them to go to.
If there's a situation like that whereby a beneficiary doesn't pay or somebody dies and they have expenses, how does the creditors recoup their money?
Well, in many cases, In many cases, that is outside of the purview of the insurance company. But for example, where you use a life insurance policy, let's say for mortgage security, in that particular instance, the life insurance policy is assigned to the bank. So legally, the bank becomes essentially the first beneficiary. The bank has to be paid out first, and then the balance is paid to the beneficiary. Again, that also, from the assignment form, that is a legal document, so to speak, that will ensure that the bank is paid out first. But as far as where there is no assignment and you just have a beneficiary, the insurance company cannot stipulate or mandate that the beneficiary uses the funds in the way that the insured would have wanted it to be used. So that is why it's also important for the insured to correctly state the beneficiary, or to state someone who they trust to carry out that particular duty after they would have died.
What happens when someone applies for medical insurance in particular? We will have to disclose all of the person's medical conditions prior and present, whether or not you were totally cured of, whether or not you still have some conditions. And it's because of what medical insurance provides for, it is very, very difficult for any person who would have already been diagnosed or cleared of cancer to get medical coverage going forward. It's a very, very steep uphill task because your medical history must be declared and your acceptability will be based on your medical evidence of insurability. So it's a difficult task for anyone to even if you're cleared to get medical insurance. And it's an industry standard.
All right. Thank you very much. Can we thank all of our panelists for dialogue too? Thank you very much.
The lessons I've learned are grounded in faith, commitment to the journey, and never-ending support. I believe faith is important and key in the process, in the journey. You have to have something to believe in. You have to believe in someone. And in our case, we believe that God will work and do what He said, and ultimately will do. He has the final say in everything, and we just left it in His hands, left it in His care, and we trusted Him to provide, to guide, to give wisdom and strength during the journey. As I said, faith, commitment to the journey, and love. I think it's important that we understand that the person that you're dealing with requires your love, your time, your energies, your efforts. They value that in those moments. Breast cancer is not anything easy, and especially if you've been diagnosed at a stage 3, 4, where things are not as hopeful as they should. It is really a challenging time, mentally, and showing love and support during that period and understanding the situation of the person that's going through that struggle is key. my wife and I, it was easy. We were always committed to each other. We started way before she was diagnosed with breast cancer to highlight moments in time where we can look back and reflect on. We call them legacy of faith moments, where we created memories. We did things out of the ordinary, you know, as a couple. Hey, a night out on the beach, under the stars, traveling, just taking a nice walk on the beach, doing things that that we can remember. And in that moment, during the struggle with breast cancer, we found it easy to reflect and to find joy and laugh and remember things. And in another sense, with the birth of our son, it was sort of a wonderful moment because it was something to cherish, our first child, after close to 12, 13 years of trying to conceive. During COVID, she was able to conceive, and I guess all of that caused us to reflect and just be happy and joyful in the moment. Even though she was struggling, she never complained, and she was always happy and you know, supporting others in the process, praying and demonstrating a level of faith that's beyond you know, even my understanding how she could be so calm and relaxed. But you have to start before anything. You have to start every day. Just live life with meaning and just understand that every step of the way, every step of your life, every engagement, every moment, everything that you do is about, you know, the next step, the legacy that you leave, and finding joy and happiness in it. So you can reflect later on and say, remember when we were here, remember when we were there, and just laugh about it and say, look how far we've come. And by faith, we're able to stand and be strong in this moment. One of the ways for me is living a life that is honorable and that can reflect her faith, remembering her faith. She truly demonstrated tremendous faith, like I said, throughout the journey. And I think it's important for others who coming after and going through this type of situation can reflect and look at someone and say, okay, even though they're going through, they have that faith, they have that strength that they can reflect, they can look at and say, okay, I can do it too. The other thing is, you know, raising my son to remember his mom, raising my son to know who she was, the type of individual she was in with regards to her faith and how loving she was. Anyone can tell you she was very calm, she was very quiet, she was very loving, she shared, and so many different aspects of her life demonstrated that type of loving kindness and faith that we saw coming out. And then of course, being an advocate for breast cancer, I understand the situation, I've been through it, I've been through the struggle with her, and so to help someone is important for me. That's why I'm doing this interview. It's not for me to just sit back and say, oh, I've been through it, I'm done, it's over. No, someone may need my help, someone may need to hear this and understand that, hey, it's okay, it's okay, I can make it, and God has my back, and I have someone also who has my back. And one of the other ways in terms of giving back, I think it's important to support persons going through. I know the struggle financially, and so I, you know, made it my duty, and I am committed to giving something back to those who are in need through the church, through foundations like Essence of Hope, and others who are in need of this type of support. So whatever little I can do through my words or financially, I am definitely going to honor her legacy in those ways.
All right, thank you. Thank you very much, everyone, for being here with us today. We truly appreciate it. I'm going to have one of our Essence members come and give some closing remarks and other thank yous. But I just wanted to insert one more thing here, that Essence of Hope is advocating strongly for a hospice facility here in St. Kitts and Nevis where persons can receive palliative care when they're at the end of life, when there's nothing further to do, that they can be, pain-free, and as well as in a space that is loving, inviting, and that they can live out the end of their life in dignity and grace. And so we are hoping to advocate, and I don't want to put it all on the government, but to anyone who is listening in the private sector as well, that a hospice facility would be something that we can welcome. Here we want to prevent as much as possible anyone having to go there, but sometimes people need these types of facilities, and we hope insurance companies will add that to their insurance coverage packages for assisting with hospice care whenever we get such a facility. So at this time, we will do closing remarks. President Pam, welcome.
Special thanks to Dr. Hazel Laws, Chief Medical Officer, all of our wonderful panelists, the Embassy of the Republic on China, Taiwan, Chameleon Media, Cleon Bradshaw, Lisi's Kitchen, Essence of Hope members. Thanks to all who took this time to attend and participate in our health forum. Redefining cancer coverage. Of course, once again, thank you to all of you. And we hope to do this again. In all that you do, remember that cancer is not a one-person thing. It affects all of us. We know of someone who had it, has it, going through it. So it becomes all of us fight. So if you want to get involved, I'm inviting you to be a part of Essence of Hope. And I'll be truthful, it's not an easy task. I won't call it a job because you have to love to do this. If you want to be a part of this group, we ask you to come on board and help us. Lots of times you have to cry. Lots of times you have to hold your stomach. Lots of time you have to be strong. It's not easy, but it's something that we enjoy doing. So if you want to be a part of us, you can see any one of the members, Marcus, myself, any one of the members, and come on board. Once again, thank you, thank you, thank you. It was very informative. And the insurance companies, I was amazed because I think you all was up to the challenge. Yes, so thank you. Have a wonderful weekend. And we'll see you all sometime soon. Thank you.
So I want to thank our President, Pam, for giving thanks. And we invite you at the end in the foyer. We have some refreshments provided by Lisi's Kitchen. We appreciate that. Our cancer thriver. And Sagicor officials will be there to give you some further information. I really want to just thank Sagicor for taking up the challenge today and answering the call. And they never, ever falter in supporting Essence of Hope Breast Cancer Foundation. Mr. Connor said annually, but I think we tap him during the year as well for other little things, and they're always on board, always willing and able to come and assist us, so we want to thank them. Because we asked all of the medical insurance providers to come, and they were the only ones who are here today. So and we have the people at the whole army. Yes, and so outside as well, we would have officials from MASA, which we know locally as the air ambulance services, but I think they provide a lot more than that, and they're going to explain that. So please stop by, have a refreshment, chat with the officials, chat with each other, catch up. And again, thank you for taking a little part of your day to be here with us. Thank you so much.